Hey guys, it's John. It's day 8 post-op, and today I got my cast removed. As you can see, there's no more that bandage looking thing on my nose anymore. The doctor put a little bit of tape on my nose. Actually, he gave me this roll of tape. He said it was hard to buy or whatever. Some kind of micropore tape, 3M it looks like. At least according to the writings that's found in the inner ring of the tape. But yeah, I'll definitely make a video showing you guys how to put the tape on. But essentially, the idea of the tape is to compress the nasal area during the nighttime to provide a little bit of structure so that, the nose sort of doesn't, expand during the sleep or whatever. So yeah, I got my cast off. It is day 8 post-op. It's been like pretty much 1 week, a little bit more than 1 week, or pretty much exactly 1 week if you count the number of hours that expired since I left the hospital room. So yeah, so exactly 1 week post-op since I left the operating room, and as you can see, my face is still very swollen. The healing has been good. The wound has closed up where they harvest my rib, just like somewhere around here. The site still hurts if I do something very strenuous, but light movement no longer induces pain. So where I'm at in this moment in time is that the scars are mostly healed and the swelling is still definitely there. My casts are taken off. I don't have to wear these tapes if I didn't want to. Probably go out if I really wanted to, but I don't know, I probably will take it easy. I might go to some events, go hang out with some people, go to some like music events, or just kind of like live a life, but I wouldn't like do anything too dramatic, like go hiking or go to a theme park or whatever. Just kind of take it easy for a couple of weeks. So the rapid healing phase of the surgery has now come to an end. The next time I'm going to see him, it's about 1.5 weeks out from today. Just going to check up on my healing progress. So as you can see behind me is an Airbnb that I'm staying at. I'm going to be leaving here in approximately 2 hours. I'm going to go ahead and Skype with a friend real quick, and I'm gonna pack my stuff up and leave, as there's no more reason for me to be here. I thought I was gonna get my nasal cast removed later this week, like Friday or Saturday or whatever, but as it turns out, he called me this morning. He wanted me to remove it today, so I get it out. And yeah, so this is pretty much end of phase 1 of surgery. So phase 2 is basically going to be from this moment in time and then up to through month 4th. So that's when most of the swelling, when I say most, I mean like 85, 90, 95% of the swelling is going to go down. The bone is going to set, or the cartilage, I should say, it's technically not bone, it's going to set on my nose. So what I'm about to say is going to be a little bit gross. So my doctor said that the cartilage is still like free floating on my face, and I can still like push it in place if I wanted to. I didn't like how it looks. I can still kind of push it in place. And so I've been studying my face. So as you can see, there's a little mole here, and the bones or the cartilage sort of arcs this way. So I'm gonna exaggerate with my finger, but it has like sort of this arc here, which means here is a little bit protruded on this side, and then here is a little bit protruded on this side. So what I have been doing is I have been going to the mirror and I've been gently like pressing this way, and then pressing this way, just very gently. As you can see, it's a soft tissue and there's a lot of wiggle room, and as I press it, my nose kind of moves, which is really gross, because I mean, if you think about it, like what's under my skin there is just a piece of rib cartilage bone. It's my rib, my own rib. And so I've been just kind of mindful of what he said and just kind of trying to achieve slightly better shape, just very gently. Like I'm not even honestly applying that much pressure, and I don't even know if it's really moving that much, but there's always going to be a little bit of asymmetry in facial structures, but particularly in this one, because I have such a large nose. As you can see, the rib cartilage is a little bit bent. You can see it's like a structure that goes this way, but then it's kind of leaning a little bit that way. So I'm going to just try to really apply pressure, I guess, on this side, especially in the midsection, trying to get it like as good as I can. As you can see, I don't know if you can see on camera, but looks about the same, maybe a little bit straighter, but I wouldn't worry too much about it. I think as the swelling goes down, it'll look all right. I mean, it's not going to be perfectly straight, but if you really look closely, like very few people's noses perfectly straight anyways. It just looks weird because my nose is so swollen and I have such a large nose in comparison to the rest of my face, which is still quite petite objectively. Wait, I'm not going to take this advice too far, but just want to kind of subtly give it that little bit of a push as the cartilage sort of sets, and the cartilage from my rib harvesting fuses with the cartilage that's naturally found in my nose and skin, which, as you know, cartilage, they don't have blood vessels running through it like, you know, muscles and bones and other tissues. So it's going to take a while for the cartilage to attach together and form a single structure. But even then, like I would imagine that the nose is brittle because this cartilage wasn't grown together as a single structure, but rather sliced together, shoved in place, sewn back together, and where the contact points are, there might be some kind of fusion eventually. But I would imagine that structurally this nose won't be as like rigid as like a natural nose, or this portion here would actually not be cartilage, it would actually be bone. So there's actually a structure, because if you look at the biomechanics of it, it's like this structure here naturally should be bone with soft cartilage that extends out and then wraps around the nasal area. But here we're trying to achieve the same look with just essentially rib cartilage, soft cartilage. But anyways, so yeah, so that's pretty much it, guys. Like just trying to get my nose as straight as possible. Yeah, and I don't know if pushing it really helps because I'm not really applying that much pressure. Maybe I should apply a little bit more pressure, but yeah, hopefully I don't mess with that more, because then I'll just have to go back for another rhinoplasty. That would kind of suck. But yeah, either way, it's day 8 post-op. The worst is probably over, so now it's just like the next 3 months, not do anything too stupid or too drastic. My face definitely looks a lot different. It's a lot more sharper and more angular. If you see my before videos, my face is a lot more round, a lot more childlike, and now my face has sort of this ninja quality. It's very sharp, it's very angular. Swelling of the eyes has gone down a little bit, making my eyes look even a little bit bigger than it actually is a little bit. As my sister pointed out, face looks a little bit mean almost, which I know that's a good thing or a bad thing, but a little bit more focused, a little bit more like intense of a look than before. Whereas before, my face was clearly very childlike, and now it's very angular and aerodynamic and very sort of sharp, I guess. Especially the chin and the nose and then the large eyes gives the illusion of, and it just has a different effect on the psyche. I think people can still tell it's me, but it's definitely like a different version of me for sure. So anyways, guys, thanks for watching. I'll keep you guys up to date. I don't know if I'll be making videos every day unless if something really interesting happened that day, but I'll definitely like make a video at least a couple times a week in the next 3-month period, just to keep you guys up to date and to see this gradual healing and going down to the swelling. As you can see, the scarring. Let's close up on the scarring. Yeah, as you can see, the scarring is not too bad. It's a little bit of blood, but that's because my nose was bleeding yesterday. But in terms of you know, the scar site, it's not too bad. And then as you can see, the eyelid. Yeah, the eyelids are very puffy still. So the chin is discoloration. As you can see, clear discolorations from the surgery, but majority of it is healed. Just like the little details has to get set, and then the nose, as you can see, just close up on the nose. As you can see, it's very big. It's almost Caucasian-like, and a little bit of a straight, but definitely a little bit off center, just a little tiny bit. As you can see when I push it, gets back, but then it snaps back in place. Probably like it'll just have to heal in this shape. I don't mind it too much. And as the swelling goes down, the size will be slightly reduced and probably look a little bit more natural. Anyways, thanks for watching.